Hi, my name is Fatthi Abdelbaki from Alexandria, Egypt, and I'm going to present on the CT of the inner ear in coronal view. I'm going to present it by level, going from posterior to anterior, and I will show the normal findings. Coming from posterior to anterior, the first level in coronal plane will be the level of the posterior semicircular canal. At this level, we can see the posterior semicircular canal as two dots. The vestibular aqueduct can be seen as a small slit medial to the posterior semicircular canal, or in some cases is not seen at all. Moving anteriorly, we will be at the second level, the level of the posterior limb of the lateral semicircular canal. Please note that the lateral semicircular canal has two limbs, the anterior limb, which open in the ampulla of the vestibule by the ampulla, and the posterior limb. So this is the level of the posterior limb of the lateral semicircular canal. And at this level, we will see all three canals: the lateral semicircular canal posterior limb, the superior canal, and the posterior canal. So in case of absence of semicircular canals, we will find there will be no canals at this level. Moving anteriorly, we will be at the third level, the level of the vestibule. This is the vestibule, and this is superior semicircular canal and lateral semicircular canal. At this level, we expect to see the mastoid segment of the facial nerve coming from the stylomastoid foramen. And this is of importance because if at this level we will not see the mastoid segment of the facial nerve, and we will see it at an anterior level, this might denote an anterior dislocation of the facial nerve. Another important point at this level is the relation of the facial nerve to the bony end of the lateral semicircular canal. Telmisani in 2017 classified this relation into three types. Type 1, where the facial nerve is medial to the lateral semicircular canal. Type 2, the facial nerve is tangential to the lateral semicircular canal. And type 3 is the facial nerve which is lateral to the lateral semicircular canal, and this is the least favorable condition for the surgeon. These are two examples of a relation of facial nerve to the lateral semicircular canal. In the first one, we can see that the facial nerve is medial to the bony end of the lateral semicircular canal, which is a good favorable condition for posterior tympanotomy. Whereas in the second one, we can see that the facial nerve is coming lateral to the bony end of the lateral semicircular canal, which make the posterior tympanotomy less favorable. Moving further anteriorly, we will find the fourth level, or the level of the lateral semicircular canal anterior limb. Again, we have to know that the lateral semicircular canal has an anterior limb which is opening with the ampulla to the vestibule, and the posterior limb. At this level, we can see the internal auditory canal, we can see the vestibule, the lateral semicircular canal and the superior semicircular canal opening in the vestibule, and the oval window. A very important structure to focus on at this level is the tympanic segment of the facial nerve, which is present inferior to the lateral semicircular canal. It's very important to focus on whether there is a bone covering this facial nerve or not, and whether it is in the normal position or it is a little bit superior or a little bit inferior at the level of oval window, or even more inferior to the oval window. One of the parameters to predict the depth of the round window niche is to measure the distance between the round window membrane and the end of the bony overhang. If it is more than 1.43 millimeter, this will denote that it will need more drilling to expose the round window niche. If we go anteriorly, In the next sections, we can identify the basal turn of the cochlea. If we go anteriorly, we go to the last level, level 5, or the level of the cochlea. Here we can see the cochlea, the basal turn and the middle turn. We can see the labyrinthine facial nerve, the tympanic facial nerve, and below the tympanic facial nerve, the tensor tympani. By this, we finish the CT scan of the inner ear in coronal view. Hope to meet you soon in another presentation.